What's up, everyone? It's Russo. I hope everyone is doing well. Please follow my Instagram at RussoLifts, just in case something happens to this YouTube channel. You can follow, message, and you can watch my daily story content on Instagram. I'll see you there. What's up, everyone? It's Russo. I hope everyone is doing well here at Elevate Alternative with
Hunter,
Kelsey,
and we're going to be discussing, they're the physicians here, and they have answered tons of calls over the years dealing with hormone replacement. And I just wanted to ask them the common issues they see in the calls, right? What is the common reoccurring problems with HRT and dealing with treatment that, again, you could generally educate yourself with? So what do you see the most when, you're dealing with these HRT calls over the phone?
I guess preliminarily, most common symptoms we see as far as why people reach out to us,
fatigue, libido problems.
energy is the biggest one I see, I think.
Kind of helping put on a little bit more muscle is kind of one of the biggest things. So a lot of guys are estrogen dominant, so some patients don't realize that before coming to us. But yeah, that's kind of one of the biggest things that we'll address.
Describe what estrogen dominance
mean in
reality.
Basically, some of these guys come in with like good testosterone levels or deficient, but if they're predominantly stronger in estrogen, they're going to have more of the estrogen symptoms. So it's a little bit more about like educating them on how to kind of treat or how to go about their HRT program, but still treating a good estrogen level and kind of keeping the balance between the two. A lot of it's the ratio, so kind of keeping high testosterone levels, but adequate estrogen levels, right? So that way they get the benefit of testosterone without the negative side effects of high estrogen. So kind of goes hand in hand.
I always tell my patients that there are ramifications on both ends of the spectrum. So too high estrogen, but also too low estrogen. That's why keeping a balance is super important. As well as, we think of all these symptoms of low T, why everyone's reaching out, why everyone wants our help, but there are, like I said, are ramifications.
I guess another thing, can we talk fertility? That's kind of a big thing that we get. So a lot of the questions we get are like, can I still do HRT, TRT?
Let's do that for a separate video.
Okay.
This is more generalization.
Okay, so we can still talk about that.
Like, do you guys have issues like on these phone calls? Like, I have a lot of guys DM me before they call you guys, right? And they're like, I'm nervous about that. Like, what would you like to see more of on these phone calls as far as transparency goes? I mean, you guys aren't biting my head off talking to me, so.
Yeah, so a lot of guys, it's nice if they knew that we're accepting of whatever it is they're doing. Pre, post, with other doctors.
So if they're already on steroids, obviously you
Fine with
want
us.
to know that, right?
Yeah, it's a judgment-free zone. I mean, the more we know, the better going into it, because if not, it makes it harder to treat if there's other things that they're taking that, like for example, if we're looking at blood work and liver enzymes start to shoot up, we usually know there's something else at play, and sometimes I think it's a little nerve-wracking from their perspective because unfortunately there's this stigma behind testosterone therapy and how terrible it is from either other providers that they've had it said to them by, or from just social media. Some people are negative about it. So it helps with them telling us everything.
And then I want to relate you guys to like a normal physician, because I have a lot of guys who go through their normal doctor, and their normal doctor will not give them testosterone even at a 250 level. Like, just go into why that in Western medicine is occurring and how alternative medicine is changing that.
So basically, from what I've seen, the reason the doctors are a little negative towards it is A, because I think they're just unaware of how to treat it. B, they're not sure what the symptoms are going to be, what their side effects are going to be if their levels come in at 1,000. I think what I've seen a lot is in medicine nowadays, these physicians aren't treating with anti-estrogens. So they start to only treat these guys at these like really low doses. What I've seen is like Cypionate 100 milligrams every other week, which isn't enough. I mean, they're going to tiptoe down to those low ranges probably 8 or 9 days after it's kind of worn off. So the physicians don't know how to also control the estrogen. So they keep them on these low doses to kind of keep their patients happy, but at the same time to give their patients kind of what they need. But the way we function, it being different, is we're able to give them high doses, kind of help them feel better, but at the same time control the estrogen. So I think that's a huge aspect of why some of these guys come in with the endocrinologist or the urologist that are prescribing the 100 milligrams every other week or 200 milligrams every other week. Also, compounding pharmacy kind of comes in together with that too, because CYP 200 is usually compounded or covered by Pfizer. They actually kind of help produce it. So compounding pharmacies, I think, allow you to be a little bit more specialized, kind of give you higher doses. And then that way we could still monitor estrogen blood work. So.
Everything Kelsey said is exactly right. And I think too, you kind of mentioned, what is the link here? I think the link missing between Western medicine and alternative medicine and where we bridge the gap is optimization.
Mm-hmm.
So say a range from, I don't know, a 400 or 500 even testosterone level, and then like you said, all the way down to 200s, 100. We've seen even lower than that, single, double digits. But like I said, optimization is the key. So although levels are okay, alternative medicine is coming in and saying, this is fine, but we can do better.
Right.
Yeah, the ranges are huge. In natural primary care, it's like 200 to 900 is what the labs show.
And if
so
you've been sitting
guys,
at 700 your whole life and something happens and you're at 400, then you're still in the range.
Yeah, and some people are like, I mean, they'll come in with levels at 300 and they say they feel amazing, no issues. And we're like, but imagine how much better you'd feel if you had a normal testosterone level. Mm-hmm. And then usually we'll talk to them after and they're like, wow, now I realize kind of what my body was compensating itself for. So that's kind of why we explain to patients too, like even though your PCP is telling you 300, 400 is normal, it's really not like where you're supposed to be. Mm-hmm. So like try this out and then you'll notice like how much better you feel and then your body starts to kind of respond to that too. So
I mean, you guys both have medical training and backgrounds. Can you go into like, in my opinion, I don't think endocrinology, unless you specialize in it, is
more
really
like diabetes sometimes
touched on.
Yeah.
Like,
no, I
did
mean,
you learn a lot in your medical school?
nothing like this.
Not testosterone therapy. They don't go to they go to
because
it
a lot of
slightly.
guys are going through their general practitioners to try and get testosterone.
Yeah. They're not gonna know. Like the primary care doctors, usually I just don't think are educated enough. I mean, you have to be like really specialized in it, which we both are. So that's kind of why we're geared to knowing what to look for in blood work, how to treat certain symptoms, and then what to test more for. Because the other thing is these primary care doctors don't even test testosterone, either in females or males. So they spend, these females and males spend all this time without ever knowing a testosterone level.
Yeah.
You know, taking all these other meds. If they only would have checked a testosterone, problem solved. Mm-hmm. So without the side effects too that you get from like antidepressants or anti-anxiety or stimulants, that kind of thing.
That was another thing too I wanted to touch on. You asked about main symptoms, why people are coming to us, what they're working with us on, and mental health symptoms are a big one too.
Yeah, I get a lot of guys who are like, they won't give me testosterone, but antidepressants, man, they have the full glossary that you can get a commission on from.
Yeah, it just messes too much with serotonin and dopamine. So then what I've had some guys do is like cold turkey, which is not recommended to take off on your antidepressants, but once they come off of that and start testosterone therapy, it usually fixes itself.
So it's low test the whole time, not.
Yeah.
Or even if it was a little bit of underlying anxiety, depression, when hormones are optimized, they find themselves feeling a lot better, being able to manage their symptoms because they have increased energy levels, overall better well-being.
Yeah. Primaries, I mean, endos and maybe urologists know a little bit more because it's focused more. They're kind of gearing towards, the urologist is more that anatomic body part they're focusing more so on, where these general primaries are looking at you from head to toe. So you come in with one problem and they're thinking maybe treating the thyroid, and it's not that, like, let's look at testosterone. A huge thing is, like, for females and males is weight gain or weight loss. And a lot of time their blood work is perfect, they don't know why. Their primaries have always told them their testosterone levels are normal, but they've been sitting at 400 for like years, you know, and then obviously that dips down after 30, and then they really don't know why they're gaining weight. So then checking a testosterone level does help, and estrogen too. So that's another thing where checking estrogen kind of helps you guide.
And you guys are symptoms and blood work based, right?
Always.
I know a lot of doctors
blood
that
work,
if the number's not there, it doesn't matter if they can barely.
The numbers help, I mean, but at the same time, how we function is based on a physician, like a patient opinion, symptoms. Like numbers sometimes say one thing, but if the patient feels terrible, I mean, you can't tell the patient they're fine.
Yes, and we dive deeper too. What I've done with a ton of patients, and I mean, they taught me this, Kelsey and our other provider, Jen, is even if we have an adequate testosterone level, but this patient's like, I'm feeling so bad, I'm having these textbook symptoms. We call it textbook is like classic what you think of as far as like one disease goes. So we'll say, okay, let's dive a little deeper, which I don't think a primary would ever do. We look at a free testosterone, because if total is good, but then free is low, you don't have a lot available
Right.
to use in your body. We look at something called SHBG, which is,
SHBG.
sex hormone binding globulin. Sometimes we look at prolactin, cortisol
That's a good one.
levels.
Yeah.
So we really go, that's the alternative medicine part, going deeper into like what's going on, why, going to the root.
Diet's a huge thing.
Mhm.
A lot of people are just eating the wrong foods.
Yeah.
Sometimes that can affect it too. Daily routine. A lot of our patients are under a lot of stress. Trying to lose weight is also really stressful. Prepping for shows is really stressful. So sometimes taking all of that into consideration is how we kind of look at everything. So that's why it helps to talk to patients to see like what they're going through, what their goals are. That's one of the biggest questions we ask,
Yeah.
is kind of like what their goals are. Because blood work sometimes does show one thing, but if they're trying to do something different, we'll try and help guide them to kind of accomplish their goals. So that way we do a little bit of both.
I guess to wrap this video out, like, what would you say to the person who's afraid to talk to you too? Because, I mean, there's so many guys who DM me so nervous for these calls.
Yeah.
I mean, we're just here to help you, I guess. We're not here to judge you. I mean, we're medical providers. It's not our position to judge you. We're here to make you feel better and help you kind of have a better outlook on life, I think. So,
And we've heard it all before. We're going to
sure
hear it
we
all
have.
again. So
yeah.
don't ever be too ashamed to get yourself feeling better. Why do you feel like patients or what do you think the guys are scared of? Just like rejection, like we're going to tell them, no, we can't help you, or?
I think rejection, and just when it comes to testosterone, that's such a hard thing.
Yeah.
Like, if I can't get my dick hard, then it's
Yeah.
very hard to talk about that.
Yeah.
And I have a lot of guys who come to me only who talk about their erectile dysfunction. They won't even discuss it with
Yeah.
their general
Yeah,
provider.
Yeah. Yeah, I mean, that's the other thing too, is like, even though we're girls, it's nice for these guys to kind of just be extremely honest with us. Like,
Yeah.
we're pretty laid back, like
Mhm.
really chill. I mean, it's not like, the more honest they could be, the better, because it then helps us, like what she was mentioning for blood work. If you're having trouble with libido, but your testosterone is great, we need to look deeper. Like doing the SHBG levels, doing your free testosterone. I mean, those two kind of go hand in hand. So it matters if we know all the symptoms, and we could care less. Like, it's just so that we know it's not coming from our perspective where we're going to judge or think any differently. So I think that's another thing guys are nervous to tell us over the phone. I can't get an erection, or like I can't maintain an erection.
Right.
Like, those are kind of the biggest ones with some of these guys, depending on ages. I mean, all the way from 16 to 65. I mean, it happens to everybody. So I guess that's a big thing, is like everyone goes through these symptoms. It just happens.
And it's normally they ran something and
Yeah.
then didn't mitigate it and
Or just
tried-
cold turkey
Yeah.
stopped, and then their
Yeah.
levels are just
and then they
down
feel
in the
like they
dumps.
did something wrong.
Yeah, so I mean, that's a big one. Like, a lot of guys also think testosterone therapy is forever. That's a question I get a lot. Like, do I have to do this forever? I mean, you technically don't have to do anything forever. The way that we phrase it is that if you want to continue feeling as great as you do, then yes, it is something that should be continued long term, because naturally your levels of testosterone decrease. So why not continue feeling this great forever, essentially? And then if other things come down the line that you want to work on, we can help kind of adjunct and add supplements to kind of help you maintain whatever goals you're trying to reach. So
Awesome.
Yeah.
Elevate is in my description below, and you can chat and talk to them within a week of submitting.